Let's speak about SEZ6, which has been most recently targeted by an antibody-drug conjugate, ABBV-706. This is such an exciting target for neuroendocrine cancers, including neuroendocrine carcinomas like small cell lung cancer. This has been studied at multiple doses. This was the dose escalation and the phase one presented earlier this year with data update. Again, looking at the responses, seeing that waterfall plot. We want to see the patients on the bottom side of the curve with significant shrinkage or complete resolution or complete response to therapy. And that's what we see. And so this was in second and third line of therapy. We see it working in both patients who had platinum resistant, less than 90 days, less than 30 days, CTFI or chemotherapy free interval. We know that SEZ6 is an important biomarker for neuroendocrine carcinomas, and having a response rate above 50% in these later lines of therapies is so meaningful. Again, looking at this spider plot, you can see that the shrinkage is quick and durable over time. So that first scan seeing shrinkage and then maintaining it with stability is so powerful for patients and their families. Another target is TROP2. This has been targeted by a drug called sacituzumab govitecan. TROP2 has been targeted actually in many other cancer types. You may see this for breast cancer or other types of cancers such as non-small cell lung cancer. The data for small cell lung cancer is supported by the study TROPICS-03 that was presented earlier this year in the Journal of Thoracic Oncology with the publication. For the phase 2 basket study, looking at the second line extensive stage small cell lung cancer setting. Again, those plots showing brisk and rapid shrinkage of tumor on the first scans, and then it's maintained over time for the majority of patients. Again, seeing that waterfall plot there with majority of patients having a best response with partial response or shrinkage of their tumors on this therapy. And so with that, the FDA, US FDA, who provides the regulatory approval for these agents, has granted breakthrough designation for both sacituzumab govitecan against TROP2 and infintamab deruxtecan, which is IDXD against B7H3 in the past year with breakthrough designation for small cell lung cancer. And so what does breakthrough designation mean? It is a designation for a drug that treats a serious or life-threatening condition, and preliminary clinical evidence indicates that the drug may demonstrate substantial improvement on clinically significant endpoints over available therapies. So this is a great first success. Does it mean approval just yet? Not quite, but this is really exciting for a designation to hopefully help fast track these drugs to a future regulatory approval. So I think stay tuned.